Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday from the HAFA office in Baton Rouge, Louisiana. I know that we are all getting prepared. Your engines are revving for Medicare open enrollment, then following with the ACA open enrollment, and you've been in the fourth quarter employer renewal time of the year. I know you're all very busy. There's so many things going on. There's so many new rules and regs coming out of CMS, and you need to be aware. You need to have your eyes wide open. You need to pay attention to what's going on. I put out last week and on Facebook that CMS released 276 more pages of things that agents and brokers needed to do. HAFA is dissecting it. If you dissect it and send a comment and would like to share with me, I would love to see it. If you have something you'd like me to share in the HAFA letter, I would love to include it. The deadline is November 12th. It's always released and required that you do your comments during open enrollment, which has been totally unfair. And I've said that for many years. However, they did release it a little bit early. Does it really make a difference? Not really. But if you could please, that is so important. The main mission or the main voice or the main thing that we want to say is CMS, you could stop the fraud and abuse by using some other method, two-factor something, besides putting the onerous on the back of agents and brokers. So this 276 pages has a script they want us to read now and things like that. Fraud and abuse is on the back of CMS. They allowed it to happen, and it's not fair for agents and brokers to be responsible for what the federal government did. So just keep that in mind. We do know that open enrollment, Medicare Part D, WellCare, some of the other insurance companies not paying commissions. Shame on you, just shame on you. If you know, I've talked about WellCare. They said we're not paying commissions, but if you do not recertify with us, we will reach out to your clients. We will try to move them into Medicare Part D. We do know, Medicare Advantage. We do know that's happening right now. So let your clients know. Be forthcoming with them. Let them know the decision that WellCare's made not to compensate you. I did run a client the other day, and WellCare came in as the cheapest, zero premium, and the total price for her drugs annually were $40, compared to the next cheapest plan, which was $400. So not only are they cutting your commissions, they're cutting their premiums, they're cutting their cost of their drugs. We know what's going to happen next year, but make your clients aware of what's happening. And let me know if I can help. I know you're working really hard. Know that I'm working really hard. And just going right into that is talking about the new $2,000 out-of-pocket on the Inflation Reduction Act. We know that's affecting premiums. In most cases, the Medicare Part D premium is going up substantially. So very important that you pay attention to that. I know you are trying to figure out what's best for your client. The other piece of the Inflation Reduction Act is effective October 15th, which is tomorrow. A letter needs to go out to all employees that are over 65 that says our plan is either credible or not credible. There's still a question on whether it's credible or not credible, and there's a methodology. What I just found out last week, and I have put on social media and will be in the Monday Morning News, is that a ship director in Louisiana that I work very closely with, which is a very good friend of mine, finally gave me some directions from CMS, which I couldn't get from anywhere else, couldn't find it, saying that those seniors will not have to enroll this open enrollment. They'll get their credible coverage letter, but they will have to enroll the next year. So you need to be aware. If you work in the employer market, that's going to happen. If you work in the Medicare area, that's going to happen. If you do not sell both, you need to partner with a HAFA agent that can help you, so you make sure that y'all keep that business and that employer has a continuity of good service and that employee is well taken care of. We know the current methodology, it doesn't look like most employer plans are going to meet the credibility coverage. We know that it appears that the federal government continues to do things to the employer market to make it dwindle. I always keep it real, speak from the heart. But when you increase the affordability factor every year by a substantial amount that the employer has to pay in order to be affordable, and then you add this piece where they're going to have employees leave the employer market and go to a government program, you don't have to be a rocket scientist to see where this is going. Three-way calls are still in place. I did see on Facebook this morning that Insure has released their button that is a workaround of the three-way calls. I'm waiting for Health Sherpa to release that at any moment. I reached out to CMS. They said, reach out to Health Sherpa. I reached out to Health Sherpa. They said, we're waiting on CMS. So it was this, the normal. So we're hoping that's going to come soon. But if you work in any of those markets, please pay attention. And also if you work in the employer and the ACA market, do not forget the family glitch information. I had a conversation with an agent this past week about our family glitch calculator that's on the website will be updated for 2025, showing the new affordability factor, meaning that if the employee or the dependent's premium is not considered affordable, they can go on the ACA and get a tax subsidy. So very important that you pay attention to that also, and that's a free link. You do not have to be a HAFA agent. However, we'd love for you to be a HAFA agent. The call center, please report those call center marketplace workers that are treating people unfairly, treating you unfairly. You need the date, the time, the state, and the phone number that was used to call in. If they're trying to sell your client another plan and or selling them dental, they need to be reported to the Department of Insurance. And if you will keep me in the loop, I'd love that. We had a meeting about network adequacy. I'm not sure how prominent that's going to be in the ACA marketplace this year, but it seems to be an issue where some insurance companies come in, lowball the premium without a substantial network. We did have a meeting with CMS. I'm not sure that we really made any progress, but as I've said in the past, with a new administration, regardless who the new administration is, they'll bring in their own folks. And immediately when that new person is put in that spot, I'm going to reach out and ask for a meeting in Washington, D.C. We need someone we can work with, and I'm excited that there will be change. I know there are still good agents that are losing your certification, being terminated from the ACA. James Napoli from Dysers Law is working so diligently. He's a bit stressed out, so if you can give him some grace. I know he has so many folks calling in that have been treated unfairly, and what's really sad is it seems that they are kind of all being in the minority sector. The agents and brokers that are minorities are being targeted. The majority of Caucasian white folks are not. I'm not sure what's up with the CMS analytics, but that's what's happening, and that's been proved in the data that he has. So know that we're working on that. The summit will be here before you know it. Please make sure to go ahead and book your hotel. Registration link will be out soon, but if I need more rooms, I want to go ahead and book more rooms. As I've said, HAFA has grown tremendously, so I know we'll have more folks at the summit. We're going to be at the Hotel Monteleon in New Orleans. We're going to have a big casino night one night. You will have a good time, I promise. But if you need me, I'm here. Have a wonderful day. I am proud and honored to represent the HAFA freedom fighters, the Ninja Warriors, the best of the best. Until next time, have a great day.